All right, and with that, I will pass over to Jane. So Jane, if you want to get us started.
Well, hello, good morning or good afternoon, as the case may be. And so nice to see so many people here today. My name is Jane Torrance. I'm an integration lead with our Kawartha Lakes Haliburton Ontario Health team. And it's my pleasure to introduce the people who are going to be speaking today. It includes Christine Keenan, who's a project coordinator with the OHT, Teresa Rye, who is the Director of Administration from CHIMO, Sharon Yo, who's a manager for hospice services at City of Kawartha Lakes Community Care, Jordan Prosper, who's the Director of Community Support Services at Community Care CKL. And from our OHT, we have, we're in beautiful Haliburton today at the Link work share space. So they're all in another room together. Stephanie McLaren is our executive director. Amanda Poirier, who you've just met, is our communication and marketing specialist. Catherine Reese is another integration lead. Jackie Beckett is a decision support specialist. So lots of people here from the OHT. Next slide, Amanda, please. We have a pretty ambitious agenda with some great learning outcomes that is going to keep us on our toes to be able to have the full presentation as well as time for questions. But this is what our agenda looks like. The navigation, I'm of course doing the introduction, and I'll be talking a little bit about our navigation platform. And excited to announce that today is the actual launch of this navigation platform. It's been sitting quietly on our website for a few months, but we haven't actually told people. So this is the first time we're telling people that they can actively go and start to use the navigation platform. Christine is going to go through the actual platform with a little demonstration, and then she's going to talk about some of the enhanced functionality. And Jordan will come in about how he has used the Community Care City of Kawartha Lakes that website to be able to with some enhanced functionality. And then we're going to hear the success stories of this navigation platform from some of the users who have already started. Teresa is going to talk about self-referral. Sharon is going to talk about receiving ocean referrals. And Christine is going to talk about making an outgoing referral. And then we will have time for questions. The OHT, for those of you who aren't familiar, has the underpinning of health equity, and I think that that's important to know that as a starting point, that is what we consider to start as health equity. But we have formed various working groups to address advanced integrated care. And working with integrated clinical pathways and standardized chronic care for CHF, COPD, palliative care, and mental health and addictions. We are working on advanced digital health to be able to provide different access to healthcare across multiple settings for both providers and the public. And we are currently and will be further engaging primary care and looking for engagement activities and increasing, especially with equity deserving populations. So as I said, today is the official launch of the platform, what we're calling our Kawartha Lakes Haliburton Ontario Health Team Navigation Platform. It is on a CareDove. CareDove is our vendor and has helped us determine what this platform looks like, and it has amazing search capabilities in the platform itself so that people can find the service that they need when they need it. There's a lot of support for public awareness and how they can access the services that are available within Kawartha Lakes and Haliburton. Many of the programs that are listed are utilizing self-referral and how to people can get to their platform or to their services, and it's just an information directory basically. Other organizations are allowing referrals directly through the site so that you can book into an appointment, and to know that it is a privacy compliant site, so that anybody who enters personal information that is subject to be HIPAA. And we are slowly introducing an Ocean integration for ease of referrals directly from primary care. So it's you can access the directory from multiple points of view, and we will go through many of those pathways today. This is what our service platform looks like. There we have 60 organizations who are currently enrolled on this platform from across Kawartha Lakes and Haliburton. And within those 60 organizations, we have 64 categories of service and 335 actual services listed. We have 12 receiving organizations, so that means that they are able to accept e-referrals directly from the site itself. And from those 12 organizations, there are 126 referable services. And we have 3 organizations that are in training currently. And so I expect within a couple of weeks, these numbers will already be out of date, and because we are expecting more to come on board. And we have 48 receiving organizations, so who are just putting out basically their telephone number and their email addresses right now, so that somebody can find the right service for themselves, or if they're a caregiver for somebody else, and know what service is available to them close to home. And we have 3 organizations that are currently accepting referrals directly from primary care through the Ocean platform. And that is Community Care, City of Kawartha Lakes, Haliburton Health Services, and CMHA. We know that our list of, even though we're proud that we have 60 organizations, there are more services out there, and we're always willing to add more organizations to the platform. And if you see something missing, just please let us know. It's an easy enough fix. And we think that over the next year, we will be continuing to build out this platform until it's perfect. But we've started with a we think is fairly robust site, but there is more to add. And here is the service organizations that are directly referable through the site. It includes the Alzheimer's Society, CMHA, CHIMO, and you can see listed on the slide what the services actually are that are available. So Community Care, City of Kawartha Lakes, Haliburton Paramedics, HHS, the health unit, our own programs through the OHT. And I know that Christine is going to talk more about the Wellness Connection, and that was actually the subject of our last lunch and learn. And an ability to actually call if you can't find what you're looking for. You can call a navigator or make an appointment to be able to talk to somebody to help you navigate through this site. Kawartha Lakes Paramedics, March of Dimes, Ross Memorial Hospital, and for their mental health and RAM services, as well as Ross Diagnostic Imaging for their Ontario breast screening program. And Point of Time and Forecast are the 2 organizations that are in training to become users, so that you can have direct e-referral through the site. And we're talking to City of Kawartha Lakes to find out how the community social services are going to be more differently represented on the site. And I think this is where we go over to Christine, and you get to see her face and listen to her voice for a while. Thank you.
Thank you very much, Jane. So as Jane said, today is the official launch of our navigation platform, which is embedded in the Kawartha Lakes Haliburton Ontario Health Team website. And so when you visit the website, you'll land on the homepage that you can see here in the slide. We're going to focus on 2 specific tabs on our homepage, which is Find Services and How Can We Help You, which are indicated by the blue arrows here. The Find Services is our navigation platform, and I'll give you a little tour of what that looks like. Next slide, please, Amanda. Under the How Can We Help You tab, you'll find important health information here. So you'll find information for if you don't have a doctor, urgent care clinics, where they are located, times and dates, chronic disease support, our community paramedicine program, where to find emergency services, and how to register for a family doctor as well. Next slide, please, Amanda. Under the How Can We Help You tab, you'll also find information about available preventative cancer screening programs. Specifically for the breast cancer screening program, which Jane has already mentioned, you can directly book an appointment to have a screening done through this tile here that says breast cancer screening by simply clicking on Learn More. Next slide, please, Amanda. Once you click on Learn More, it will take you directly to Ross Memorial Hospital's diagnostic imaging page of their website. And you can see here again with the blue arrow, you just simply click here to book. Next slide, please, Amanda. And it will take you directly to their booking page where you can book a date and time to have a breast cancer screening done. Next slide, please, Amanda. Under the Find Services tab of the website, this is where you'll find the navigation platform. And so you can search for health and wellness services and programs for yourself or for a patient. You can search via the categories that are listed here on the slide, or you can do an advanced search and search by organization, program name, etc. Next slide, please, Amanda. Of the service that you are searching for, the results will appear based on your proximity to your home address. So when you're searching for a health or well-being service or program, you always start by entering your home address first, and then you can see here on the map where the services that you're looking for are located in proximity to you. Next slide, please, Amanda. In some cases, as Jane also previously mentioned, you can directly refer yourself or a patient to a program or a service. This is identified by the blue Request Service button you can see here on the slide. You would simply click this button, enter in the information that is required by the program, service, or organization, and hit Submit. Once you've completed that e-referral, it will go directly to the organization, and if you have an email address, you will receive an email confirmation that the referral has been submitted to that organization or service. Next slide, please. One of the enhanced functionalities of this navigation platform is that along with an e-referral, you can also directly book an appointment for some programs and services. So the example here is the Wellness Connections program, which is led by the Kawartha Lakes Haliburton Ontario Health Team. And so once you complete an e-referral, either for yourself or for a patient, you can also book a phone call appointment with the lead of the program to call the client or call yourself to give you more information about the program. Next slide, please. Once the e-referral is completed and the appointment booking is completed as well, again, if you have an email, you will receive an email confirmation of the appointment date and time and confirmation of the appointment. And so the confirmation will go to the person making the referral and the organization receiving the referral. And so you can see here in the Wellness Connections inbox, these are the booked appointments that have been booked directly through the navigation platform. And so it's really easy. If any organization is interested in having that enhanced functionality, they can reach out to the KLH OHT, and we'd be happy to work through that process with you. Okay, so now I'm going to hand it over to Jordan, who's going to talk about having the navigation platform embedded directly in their organization's website. So over to you, Jordan.
Thanks, Christine. Hi, everyone. So just to give you the team a little bit of history, I believe it was around December or January, December of 2022 or January of 2023, we launched a new website with community care. So we took the opportunity to revisit sort of how it was not only designed coming in, but with the CareDev platform launching, we wanted to take advantage of that. So historically, this Let's Get Started button that you see there, when someone would click on our website to sort of register, it would take them to a generic HTML form that our IT team didn't love, and we wanted to see how we can embed this in the CareDev platform itself. So if we can go to the next slide. So essentially, when anybody clicks Let's Get Started or clicks on our programs and service listing on our website and clicks Register Now, it directly leads them to the CareDev platform where all of our services are listed. Our team does a good job of keeping this up to date and relevant, whether it be from service fees to program timing, availability, etc. So now every program, when you want to register, lands you right on the CareDev platform, and that was a change I think that we took on around April of this year. Our eligibility criteria is all outlined here, whether you're a game client, whether you're registering for Meals on Wheels, whether you're registering for transportation or Good Food Box. Our eligibility criteria is listed right on this platform. It's very user-friendly. Our team loves it. And we have 5 individuals where the referrals would land on an internal team here. This is an example of some of the information that clients, caregivers would enter. It's again quite user friendly, very generic, high level information, name, address, birthday, gender, and it's all PHI compliant. And that was our number one question with all this when we were getting introduced to this platform. And the team themselves did a really good job of putting our mind at ease that all the information that's going to be captured in here is PHI compliant. We can securely provide service to individuals in a different platform. So once the individual is completed their registration or their onboarding per se, they have the ability to get their client consent electronically. And if you move to the next slide, this is an example of sort of what it looks like. So if my mother was taking care of this herself, this is exactly what she would see. She would be able to print it or download it herself just to keep for her records. And then the following slide would show what we see on the back end from an organization perspective of how quickly it comes in our wheelhouse. So we have 5 individuals, I believe, that take care of all this, and they're a fantastic group that help stick handle all the requests that come in. We've received, I think, 175 referrals to date since launching through the CareDev platform. They vary from themes to Good Food Box, our Soldiers of Change group, Foot Care, Meals on Wheels, and it's all right embedded into this. Our team has the ability, you'll see those icons on the right-hand side highlighted in green of if they're complete or not. And the reporting structure associated with this with CareDev is really, really user-friendly as well, where we can identify from time of referral received to time of referral completed, how long it takes our team and what benchmarks we want to set. And it's really it's a really helpful tool for us to utilize. So we're really happy that we've went this route, and our clients are satisfied as well. We're about to send out our client satisfaction survey in the next couple of weeks, so we'll see any additional feedback we've gotten. But the user friendliness of not asking individuals to complete 3 or 4 different forms to welcome them to community care has been value added since we jumped in this process.
That's a great overview. Thank you so much, Jordan, for doing that. And so we're going to continue and talk about some of the success stories from organizations that have been using the platform. And first up, we have Sharon Yo, who is the manager of hospice services. And just so you know, these success stories, the names have been changed, obviously, for privacy reasons. But Dr. Jones has referred a patient to Community Care City of Kawartha Lakes Hospice Services, and Sharon's going to talk about how well that went. So over to you, Sharon.
Thanks, Christine. The scheduled presenter was Megan Tremblay. She's the team lead for the palliative care community team, so I'll do my best to fill her spot. So Dr. Jones has sent a referral. We received a referral from Dr. Jones on September 21st. Dr. Jones would have been in the Ocean integration and clicked on where the red arrow is, clicked on the red arrow that they needed the PCCT team. Next page. She read the criteria and determined that this client was appropriate for these services and simply hit the send e-referral. Once the doctor filled out all this information, and this doctor was super fantastic and gave us extra information. The next slide, please. So once the slide shows an overview of the services, the Dr. Jones would have just clicked on the drop down for the referral options and clicked PCCT. Next slide. Filled out all the information for their patient. Next slide, please. And they would receive this printout that the referral is complete and that it's gone to the same slide that Jordan showed earlier. This is a great indicator that it is complete, nothing's outstanding and nothing's missing. Next slide. So from our side, Megan would see this, the team lead, and she would easily click on the referral and see who needed our services. Next slide. And what happened was Dr. Jones created a attachment that included all of the patient's oncology notes, diagnostic imaging, clinical notes to support the referral. And this is super beneficial for us because those extra notes help the nurse navigators and the physician teams. So after completing the intake with the patient on the 22nd, PCCT went back in and clicked that on the status update where the red arrow is. And that sent a note to Dr. Jones letting them know that the team had completed the referral, completed the intake, and a message went out with the date of the planned meeting with the nurse navigator and the name of the nurse navigator should the doctor want to contact the nurse navigator that has that patient. Next page. And it's closed quickly. So in 1 day or 2 days this took place. We received the referral, had the intake, and then we're able to close the referral. Next page. And I just wanted to add a little bit more. We have recently had an intake just last week, and the client, the doctor did not give enough information. So we were easily able to, through CareDove, let the doctor know that we needed more information, and that was all done through this platform. No phone calls, no faxes, nothing else had to take place. So this is very easy to use, and this is definitely a success story.
That's great. Thank you
Thanks.
so much for sharing that, Sharon. And to continue with our success stories, we're going to hand it over to Teresa Rye from CHMO. And Teresa is going to talk about Braden, who's 14 and was looking for mental health support in his community. He searched the KLH OHT website and found CHMO and completed a self-referral. So over to you, Teresa.
Thanks, Christine. So yeah, so Braden was able to access, make a referral. Now, if we look at the embedded services search, if they looked up CHMO or if they looked under, children's mental health or children's services, they would find us listed and they could select different services. I should note that the nice thing about the CareDove platform is whether a youth or for children younger, you might have caregivers filling out the self-referral. It looks the same whether they access it through the OHT navigation site or from our website. It all comes down into the CareDove platform. So that's very, very helpful. Next slide, please. So Braden would click on, say he's looking for brief services. He can click on request service, and then he would just be queued to fill out the necessary information to complete the referral. And then based on the information that Braden inputs into the referral in terms of where they live, it would bring up the listed services that are available, because some of our services, you could have someone accessing this site from Durham region or Halliburton or maybe even Peterborough. And so depending on, certain services are only available depending on location. So for Braden, these services were available to choose from. And then Braden would be queued to complete the demographic information. We really like this because you can make phone call referrals for our services, and sometimes deciphering some of that information is difficult based on voicemails left. So we love that this information is inputted directly by the individual so that we get the correct information. And of course, the being able to consent and having all the information HIPAA compliant is helpful. So Braden would just fill out that information, click submit, and they would receive this referral confirmation that the referral was sent. So we have two main intake workers that would be checking this referral inbox on a regular basis. And the nice thing about this is we're able to, they're able to see it, and we usually are able to respond to the individuals within 1 business day, 2 business days maximum. And because we do have multiple people looking in the inbox, the update status on our end is simply just a matter of being able to show that the referral was attended to, the contact was made, and then we're able to close out the referral and archive it as needed. So I just want to say that we're very happy with using the CareDove platform. It's been seamless, and we definitely try to encourage our referrals to go through the online piece when possible, just because we are able to get such accurate information and can respond timely.
That's awesome. Thanks, Teresa. It sounds like it's working really well for your organization as well. Thanks for sharing. Okay, so I'm going to share the last success story. And so this is Christine. She's a housing support worker, and she meets with a client in their home and determines that the client would benefit from Meals on Wheels. And so as a housing support worker, Christine does not receive referrals from either people in the community or other organizations, but because she wants to serve her clients better, she sets up an account on CareDove so that she can make outgoing referrals to organizations to support her clients. And so in this case, you can see here that she has her preferred networks, that she often refers clients to community care programs because they have such valuable programs offered. And so what she does is she goes into her account, she clicks on her preferred network, she goes on the Meals on Wheels, she goes through the referral process as Jordan outlined previously in his talk. And as a housing support worker who has an account with CareDove, Christine can also track the number of outgoing referrals that she makes for her clients. And so she's able to see trends, and she's able to report back to her organization as well. And what she really likes about it is that rather than giving a client a pamphlet and hoping that they reach out to the organization on their own, when she leaves that appointment with her client in their house, she knows that a referral has been received by Meals on Wheels and that they are going to contact the client and set up the process to make sure that she's getting healthy meals in her home. And so that is also an option for organizations. If you want an account on CareDove, even though you don't receive referrals, you can make outgoing referrals to better support your clients. If that works for you, again, just reach out to us at the KLH OHT, and we would be happy to work through that process with you as well. And so those are some really great examples of how well the platform works and how it really supports not just the clients, but the workflows of different organizations too. And so that's the end of the third episode of our Lunch and Learn. So thank you very much for attending. We are going to take a break from our Lunch and Learns in December, and we'll start up again in January. Just a reminder that these are recorded. They are available on our YouTube channels and will be available. The link will be available for those of you that would like to share it with others in your organization, watch it again. Up to you. Next slide, please, Amanda. Okay, now we have time for questions, and I think we're making good time. We have 15 minutes. So any questions, feel free to put them in the chat or raise your hand, and happy to answer them.
While we're waiting, Christine, I just wanted to say, it's Jane here, that one of the things we've just introduced this week in connection with their launch is we have embedded a survey in our website that is recording what the experience is like going through this navigation process. You saw everybody demonstrated the client receipt once the referral was complete. There will be, if the client has provided an email address, there will be an automatically generated survey also going to that client. It's 5 simple questions. It's 30 seconds to complete, but it's really, how was the navigation process? And if there's a service that wasn't available that they'd like to be available to ask, what couldn't they find? But it will help us have continuous improvement in the platform, because we really do want it to be the most complete as it possibly can.
Thank you, Jane. And I also just want to reiterate that there is a phone number available as well. And so if you're not comfortable with technology, or you're really not sure what you're looking for and you just need a little bit of guidance and have a conversation with somebody, feel free to call the phone number as well, and we can help you find the service that you're looking for.
So Christine, there was just one question that came in asking if we can share the web link again to the platform. So I don't know if Jane or Christine, if you want to paste that in the chat, and what I'll do is after this, I'll send just a follow-up email around, and we'll be sure to include the link to that platform as well.
Yes, I can put that in the chat, no problem, Amanda.
Okay. And then we had another question from Darcy come in saying, I'm a diabetes educator at the Ross and very interested in setting up an account to refer my clients for foot care, food security, mental health support. How can I get this started?
I'm putting my address into the chat as we speak, Darcy. And if you connect with me, I will connect you with CareDev, and it's a very easy way to get this started. So we can do that almost immediately.
Thank you for being that point of contact, Jane. And then I see that Dr. Ekob has your hand raised. If you wanted to come off mute.
Okay, can you hear me now?
Yes.
Okay, all right. Yeah, I'm Naomi Ekob. I'm a family doctor in town with the family health team. And thank you for that wonderful presentation. Very interesting indeed. And I see you have an ad in the Advocate about your services. And about the whole, how to find things in Kawartha Lakes, which is great, I think, for me too, as well as others, people in town. How are you preparing to sort of, let all the public know about this service?
Did you want me to help with that question, team?
That'd be great. Thanks, Amanda.
So how we planned on doing this is that we're doing sort of advertisements in local papers, both in Kawartha Lakes and Haliburton County. Those should be coming out over the next couple months, just to help raise awareness about that. We're also visiting more sort of local areas within communities, such as libraries, rec centers, things like that, actually putting out physical flyers, postcards, to help spread the word that way. We do have our standard social media channels too. We know that not everyone enjoys using social media, so we want to make sure that we get those kind of community centers and locations in Kawartha Lakes and Haliburton County too. So that's our sort of main focus right now. Okay. We've also had a couple press releases put out through local news publications too, which is great. We've had good feedback from those too. So that's our kind of main ways to promote this right now. As always, if anyone has suggestions or areas you think that we should target, we are always open to that as well.
Yeah, you might want to try the family health team office to leave pamphlets or whatever there.
Yeah,
And perhaps the doctor's offices too might appreciate some of it. Yeah.
absolutely. Yeah, we'll make sure to get some material in all those
We're all,
locations.
I wasn't aware of all this until now. So, yeah. And do you know if there will be integration with our offices through Ocean? Because I have Ocean and I do some referrals through there. There's not a lot of e-referrals I do for patients. But is that coming on board soon, or what's happening there?
That's a great question. It's Jane here. Right now, currently through your Ocean platform, you should be able to make e-referrals to community care at both CCCKL as well as HHHS. And so, yeah, and also to CMHA. So those are the venues available, or the organizations available to you right now. We are working on bringing more services into Ocean, but it's and then we were going to have a special launch for primary care.
Oh,
but
good.
those are available to you right now, just so you know. Or you can always just, if you wanted to bookmark the OHT website, so
Yeah.
you could always just log right
That
in
way.
from your office and do your referrals from, not through Ocean, but through that CareDove platform that's on our website.
Yeah. Okay, that's good to know then.
Thank you.
And what was the other thing I was thinking of now? Oh yeah, I just worry about I know some of my elderly patients have really either no computer experience or don't have a computer or can't use it and whatever. I suppose they can always get caregiver to help them with some of that, e-referral. But that's not always available to them either. And I just wonder about the usability for, other people who have some maybe disability or elderly who can't use computers like me.
That is such an excellent question, Dr. Jacob. It's why we have a phone number and a person who can answer the phone and who can walk the patient through the process and help them. So that it's what you see on your screen right now, that phone number, and you will always be able to reach somebody through that.
So
Not during office hours, not always, but going through the number, that we do have that available as well.
Okay, great. Okay.
Yeah, and just to add to that, Dr. Acob, the person calling, they actually get me when they call the phone number.
Okay.
And so I can complete an e-referral with their verbal permission on the phone.
Oh, wonderful, wonderful. Okay, that's great to know.
Yeah.
Good, because I know when I had tried with, virtual appointments and things in my office, it did not work.
Yeah, it can be difficult.
For a lot of people. Yeah, they
sure.
want to deal with that kind of thing. Yeah.
Yeah.
Jordan, I
Okay.
see you have your hand up. Did you have something to add to that piece?
Yeah, I know, just an additional comment to Dr. Ecomb. Our agency had a similar observation too, like a number of clients and programs that we wanted to gear towards older adults. And the idea for us wasn't to completely eliminate them calling in. It's an additional way for them to access care and get started. And so I share the same sentiment that you do, where you're not sure if the buy-in is going to be there necessarily, the usability for your clients, but the platform is quite user-friendly, and it's not meant to sort of eliminate another process. It's just to complement others. So yeah, I think it'll be met with some success.
Okay, great. Thank you.
No problem.
Thank you for that, and thank you for the question. So I don't see any other questions that have come in on the chat, and no one else has their hand up. So I don't know if Christine or Jane, if you wanted to say any closing remarks before we close the session.
Well, I'll start, and Christine might also have something to say, but just wanted to thank everyone for coming. I think that this is our launch, and I expect over the next 6 months, we will have more and more growth in the website, in the number of services that are available, but also in being able to customize it a little bit as people tell us what they actually need from the site. We are also working on, when you go to the site, there are a few different ways to organize the information. And so that can be in constant improvement. We also know that Health 811 across the province will be coming on board, or it's already available right now, but it's going to become more and more prevalent across the province. This site is integrated with Health 811. So if a patient goes to Health 811 first, they will be referred to our site. So it becomes a little bit streamlined for Kawartha Lakes Haliburton, and makes it a little easier for navigation, which should be simple, and we all know is not. It is the most difficult thing for people to find the right door. And so our goal is, of course, to make it the easiest thing possible, to find an easy button, and we're hoping that this is it. That's all for me. And Christine, do you have the last word?
Sure, yes, just thank you so much for taking the time to join us for this episode 3. Thank you very much to our speakers today. They did an excellent job demonstrating the benefits of the platform and how well it's worked for them. Thank you to people who attended for your comments and your questions and your suggestions. It does help us to continually improve. We're excited to do outreach and have people visit the site, call the phone number. And if you have any questions, feel free to just email us or give us a call, and we'd be happy to help. So thank you very much, and hope you have a great rest of your day.
Thanks.
Thanks, everybody.